So, like Béchamp before him, Anderlein identified this ubiquitous protein colloid that participated in a really determinative way in all these amazing pleomorphic transformations, and he used the term endobiont to describe the protein colloids from mucorosmosis and Aspergillus niger because they existed in all vertebrates and they were important in all of these fundamental relationships that we've talked about. They exist in all of the fluid compartments of the body, inside the cells, outside of the cells, and in the germline cells, in the sperm and in the ovum, so that they are continuously passed on to the offspring. And they participate in orchestrating the progressive pleomorphism of more and more complex biological forms within the cyclode that eventually become saprophytes and do the recycling, or can, on a different pathway, become mature regulators that act as the isopathic forms that bring down the pathogens and regulate them once again. And they perform, in their primitive phases, important physiological functions, according to Anderlein. Mucor, in terms of giving the body the capacity to clot blood and therefore evolve extensive vascular systems. And Aspergillus, the ability to crystallize protein, to crystallize collagen, and to create the rigid, weight-bearing endoskeleton that allowed the development of large multicellular creatures. So, inside the isopathic pleosanum remedies, what we have are the primitive phases, the primitive morphological colloids for the particular cyclode, whether it's mucor or Aspergillus or one of the penicillia and so forth. And it's important to understand that these colloids don't directly go in and do what they do. These colloids go into the body and they provide the building blocks necessary to trigger the subtle developmental pathway through which those spermate forms that we talked about earlier develop. They don't actually just develop on their own. The first thing that you'll see if you track this, looking at live blood through the dark field microscope, is the emergence of a very fine diaphanous sphere that has no stippling, no points on it. And then over time, tiny little points will develop and begin to sprout little whiskers, little tails on them, and then eventually you have a form that Anderlein called the dioecothécete. And this dioecothécete will eventually tear. The membrane actually tears and opens, and all of the little fine tails and points then swarm out of it and become the spermates, and the spermates connect to the higher valence forms, the more complex pleomorphically progressed forms, and cause them to lose, in the terminology that I like, to lose their biological ego, to lose the thing that holds them together as living forms that have their own needs, their own metabolisms, their own demands, and are therefore capable of pushing the internal milieu of our bodies into what we perceive as and experience as disease states. When they lose their biological ego, when the wind goes out of their sails, they simply move from being biology back to chemistry. They move from being alive to being building blocks that the elimination processes of the body can take care of and can flush. Now, it's important to recognize that the isopathic pleosanum formulas need the appropriate milieu, need the appropriate terrain to operate in, because they don't just go in like an antibiotic medicine and kill things and work. They actually have to pass through several subtle stages of development, just like the progressive pleomorphism of the pathogens have to go through a milieu-directed series of stages. This is why we always do the terrain therapy in concert with the isopathic therapy and the other forms of biological therapy that weave in and out and support the healing process.
Stuart, can I just to summarize it in a simple sentence, the isopathic pleosanum remedies, essentially what they're doing is they're the more basic forms, and they're going in, merging with these more high valence pathogenic forms and breaking them in these big complex structures back into their countless primitive non-pathogenic forms.
Right, right. And if you have not changed the milieu, if the biochemistry and the energetics of that milieu is still as degraded as it was before, it's a trampoline. Now that degraded material will have the environment to bounce back up again, which is why it's important to change the terrain, then break the cycle, and reduce the valence of those higher forms, and then support the channels of elimination to get that material that no longer has an ego and no longer has an agenda, to get that material flushing out of the body. That's the way you break the positive feedback loop that we've talked about.
And that's what we're going to talk about shortly, and we're also going to tell you how to do it.
Yes. So just to recap, these isopathic remedies are non-toxic, they're non-allergenic. It's interesting, some of them are derived from different species of penicillium fungus, Penicillium notatum, Penicillium frequentans, Penicillium roqueforti. They all have different domains of action in the body, and people will frequently say, well, I have a penicillin allergy, so I guess I can't use those. Well, penicillin allergy is a hypersensitivity to penicillic acid, and these isopathics, even though they're derived from Penicillium fungus, don't contain any penicillic acid. So this remedy will not stimulate an allergic reaction. They are non-allergenic. They're free of all side effects except for those that are related to the fact that they mobilize toxins and degraded pathogens, degraded biological materials. So if you've done an appropriate job of supporting the organs and the channels of elimination, and you've done an appropriate job of paying attention to your patient and titrating their dosage, and thereby controlling the rate at which you're breaking down this material, you can take people through this process without creating undue stress for them. And even the stress that they do experience is not actually a side effect of the remedy, it's an effect of the body healing. And you do your best to manage that so that people have a positive experience and therefore are very happy in adhering to the therapeutic protocols that you've made for them. And we've touched on this before, it's appropriate for every age group, including the in utero fetal age group, because these are fundamental processes that are common to all of the different stages of human development.
Exactly.
Good.